UNICEF, working closely with Africa CDC, Gavi, and WHO, has urgently called for Mpox vaccines to be secured for countries hardest hit by the ongoing outbreak. The goal is to swiftly provide vaccines to critically affected areas. To expedite this, an emergency tender is being set up to establish agreements with vaccine manufacturers. This will enable UNICEF to purchase and deliver vaccines immediately once funding, demand, and regulatory approvals are in place. Depending on production capabilities, up to 12 million doses could be secured by 2025. This urgent action follows a severe Mpox outbreak in the Democratic Republic of Congo, where over 18,000 suspected cases and 629 deaths have been reported this year. The outbreak has also spread to neighboring countries, leading the WHO to declare Mpox a global health emergency. In addition to securing vaccines, the partnership aims to increase vaccine production and facilitate donations from wealthier countries. UNICEF is also deploying critical supplies such as protective gear, testing kits, and treatment materials to help manage the outbreak in the hardest hit areas. Vaccines are seen as a crucial tool in interrupting the transmission of Mpox and protecting vulnerable communities. With this initiative, UNICEF and its partners are working to ensure that vaccines and other vital resources reach those who need them the most as quickly as possible. Here is what WHO had to say on vaccines to combat Mpox.
WHO is working to accelerate access to and delivery of vaccines. The safety and efficacy of vaccines are our highest priority. We will not take shortcuts. Yesterday, we also invited manufacturers of Mpox diagnostics to submit an expression of interest for emergency use listing. It's vital to stress that although vaccines are a powerful tool, they are far from the only tool. There are many things that WHO and our partners are doing to prevent and diagnose infections and treat the sick.